Okay. So when we speak of vital signs, okay, so we're talking about temperature, pulse, respiration, and your blood pressure. Okay. So why do we take the vital signs of the patient? Okay. Why? We check this to monitor the functions of the body. Okay? If your body is functioning well or not. Okay. So it should not be automatic. Okay? It should be systematic. Okay. Scientific assessment. Okay. And we always compare the results that we get based on the standard values. Okay. The normal standards. Accepted normal standards. Okay, so if they ask in the exam, when should the nurse take the vital signs? So keep this in mind, okay? When? When should you get the vital signs of the patient? Or number one, when you admit the patient. We call it the baseline data, okay? Next, before and after surgery or any invasive procedure. Okay, remember that, any invasive procedure. Okay. Before and or after administration of your medications, especially those that affect the vital signs, right? When you give epinephrine, right? Okay? So anything that will affect the vital signs, any medicine, right? So like when you give your inhalers to patients with asthma, so you have to check the RR again. Okay? Before, after giving medications. Right? Before and or after. Okay? Before and after or before or after. Stomach, abdominal pain, stomach ache. No, this medication means those medicines that may affect the vital signs. Okay. Like, I give you example, like if the patient have fever and then you give Panadol, okay, so you have to check again, okay. Especially those medications that affect the heart rate, right, and RR, right, respiratory rate, okay. Before and after any nursing intervention that could affect the vital signs, for example, walking, okay. Okay. And lastly, when there are changes in the patient's status or when he reports new symptoms. For example, nurse, I have headache. So you check the blood pressure. Maybe the blood pressure is so high. Okay, you don't have to memorize this. Okay? Just read it. You have to see the variations in the normal vital signs. As you can see, based on the age, okay, neonate means newborn. Okay? So they have lower body temperature compared to the adults, okay? There, okay? This one, we call it the mean, right? Mean means the middle, right? The one I wrote here are the range, okay? Range means from this one to this one, right? Range, okay? As you can see, look at this, okay? In the newborn, the heart rate is 120 to 140, okay? So it can go as high as 220, okay? Especially when the newborn is crying, okay? It's still normal, okay? Because in the NCLEX exam, they will ask, say, like, the newborn vital signs are pulse rate 220 and is crying. What should the nurse do? So when you say like that, so you think it's the baby's crying and the pulse rate is 220, so it means normal. So you don't do anything because it's normal. Okay? So it's important for you to know the range which is normal and abnormal. Okay? So you can interpret the question in your NCLEX exam. Okay? So you can know if the condition is normal or abnormal. Okay? Okay, finished. Okay. So let's discuss each one of them. Okay, let's go first to the temperature. Okay. So temperature, how do we define temperature? The body's temperature, the balance between heat production in the body and the heat loss from the body. Okay. So how do we measure the temperature? What is the unit of measurement? What's the unit of measurement? For example, 37. What do we write here? What do you call that? How do you say it? How do you say it? This is how to read this. How do you read this? 37. Here, I show you. There, read. 37 degree. The small circle means degree. And then C, read. Celsius. Celsius. There. Okay. So that's how to say temperature to the patient. So you say, your temperature is 37 degree Celsius. Okay. In America, they use the F. Right? What is F? Here. Read. Practice so you can know. Fahrenheit. Say, how do you read this? So 37 degree Fahrenheit. Degree Fahrenheit. Okay.
So we have to say Fahrenheit.
No, degree. You have to mention this one.
So this one says 37 degrees.
Degree Celsius.
Okay, we have to say Celsius.
Fahrenheit. Yeah, you have to. This is the unit of measurement. Okay. So 38 degree Celsius. Okay. Have you finished copying this one?
Yeah.
Okay, table. Okay. There are 4 units of measurement. You have Celsius, Fahrenheit, Kelvin, Rankine. But we don't commonly use these two. Okay? We use this one and this one more often. Okay? So never mind the other two. This is just nice to know. Okay? But in the United States, they use Fahrenheit. So how do you convert? If they ask you in the exam, convert. How do you convert? So the other name for Celsius, say, formerly it's called centigrade before. But now we don't use this one. We use this one. Okay? So how do you convert? Here. Okay? So here. If you want to convert Celsius to Fahrenheit, so here, you copy this. Celsius times 9/5 plus 32. Okay? If you want to convert Fahrenheit to Celsius, so here, okay, you put the Fahrenheit here. For example, 100. So minus 32 there. And the answer there, you times 5/9 to get centigrade. Okay? You have to memorize this before you take the exam. There. Okay? Look at this. Okay? So 1 degree Celsius is equivalent to 1.8 degree Fahrenheit. Okay? Never mind this one. This is not commonly used. Okay? Okay? There are 2 kinds of body temperature. Okay? 2 kinds. We call it core temperature and surface temperature. When you say core, meaning in the center, so inside the body. Okay? the temperature of the deep tissues of the body. Okay, example will be your abdominal cavity. Okay, it remains relatively constant. Anywhere you get the temperature inside the body, it's the same anywhere. Okay, can you give me the other cavities in the body? What are the cavities in the body? Yeah, what they call the cavity in the chest. Ah. Oh, here, you call this abdominal cavity. Oh, you say chest. What do you call the cavity in the chest? You call it thorax, right? Thoracic cavity here. Okay, here. I read thoracic. Read thoracic. Okay, thoracic cavity. Okay, here, the chest. Abdominal cavity. Oh, what else? Here, pelvic cavity. Here, lower. What else? In the skull, here, what do you call this? Cranial cavity. Okay. So these are the 4 body cavities. Okay. Okay. At the back, you also have the dorsal cavity here, right? In front, you have the never mind this one. So you have the cranial cavity, thoracic, abdominal, pelvic. Okay. And then the spinal cavity, of course, here. Okay. Spinal cavity. So if you get temperature here, the same. Okay? We call it core body temperature. Okay? Okay, clear? Next, you also have what we call the surface body temperature. Okay? When you say surface, this is the temperature of your skin, the subcutaneous tissue, and the fat. Example, here, when you put here, okay, that is surface temperature, okay? So it rises and falls depending on the environment, right? It changes. So remember, core temperature is constant, surface changes, okay? What is the normal? This I use the symbol N like that. Normal. Okay. This one temperature. Okay. Because if I write the whole word, it will be longer. So you use symbol. Okay. The adult normal temperature in the mouth. Okay. What's the normal temperature? If you take the temperature in the mouth, 36.7 degrees centigrade to 37 degrees Celsius. There. In Fahrenheit, it's 98 degree Fahrenheit to 98.6 degree Fahrenheit. Okay. So if you use the formula earlier, you convert this into Fahrenheit, you will get 98. Okay. This is just to give you an idea of the normal body temperature. If you get the temperature in different parts of the body, through the mouth, through your anus, and under your arm here. Look at this. Which one is the highest? This one. Rectal, right? 98, 99, 97. Same. So the rectal route in getting the temperature is the most closest to your core body temperature, right? The most exact, right? There, okay? That's what it means by this table, okay? Okay, let's now go to factors affecting the body's temperature. So what makes the body temperature go up, go down? Okay? Number one, age. Age is a factor. Remember, infants or newborns are greatly influenced by environmental temperature changes. That's why if you have a baby, when you go outside, you have to cover them because their temperature changes very fast than an adult. Okay, so infants must be protected from extreme temperature changes. Okay, next, besides the infants, you also have to consider the elderly. Okay, people who are more than 75 years old, okay, they are at risk of hypothermia. Hypothermia means low body temperature. Okay? Below how much? Below what? 36, okay? Below 36 means hypothermia, okay? And older people are sensitive to extremes in temperature. They cannot tolerate very hot or very cold weather, okay? What's the reason for this one? Why? Why? Older people are sensitive to extremes in temperature. Why? This is the reason why. Okay? Due to decrease in your thermoregulation. Okay? We use the term thermoregulation. By the way, where is the temperature control in your body? Where? Oh. Which part of the brain? Which part of the brain? Where? Hypothalamus. Okay? In the hypothalamus. Okay? We use this term, thermoregulation. Okay? When you say thermoregulation, the ability of the person to keep its body temperature within the normal. Okay? Right? The body controls your temperature. Okay? There. Okay? Even when the surrounding temperature is very different, like now, winter, it's cold outside. The body should maintain warm inside, right? That is your thermoregulation. In the elderly, they have this one, and there's decreased thermoregulation. Yeah. That's why they are more sensitive to temperature changes. Okay? Okay. Next will be circadian rhythm. Okay. You know circadian rhythm? When you say circadian rhythm, this is the thing, the changes that happens to the body, there, Chinese, during the day. Okay? One day. Okay? Okay? Changes that happens in your body during the day. Okay? Circadian rhythm. This is the one controlling your activities during the day. Like, for example, if your normal time for sleeping is 10 o'clock, okay, every 10 o'clock in the evening, your body starts to fall asleep. Okay? That is circadian rhythm. Okay? Okay, so remember, temperature changes throughout the day, okay, in your body. Okay? The highest temperature, when can you get it? Between 8 p.m. and midnight. So when you get your temperature during 8 p.m. and midnight, it's high. If you compare it when you get it between 4 a.m. and 6 a.m., which is the lowest body temperature, that is normal, okay, because of your circadian rhythm, okay? Another factor would be exercise. What happens to your body temperature when you exercise? Of course, it will go up. hard work or strenuous exercise, we use this adjective. Okay? Strenuous means you exert too much effort in doing something. Okay? So hard exercise. If we don't say hard exercise, we don't say difficult exercise. We use strenuous. Okay? So it can increase body temperature to as high as, look at this, 38.3 to 40. Okay? It's like having a fever. Okay? For females, okay, another factor for you to consider is what? The hormones. Okay? This was asked in your NCLEX exam. What hormone in the woman is responsible for the elevation of your body temperature during your menstruation? The answer, progesterone. Okay? Progesterone secretion at the time of ovulation, you know ovulation. Ovulation means the egg cell rupture, the follicle ruptures to release the egg cell. Okay? So during that time, your body temperature is, you feel hot. Why? Because of progesterone. Okay? When is ovulation? When does ovulation happens? Day? How many days is your menstruation? 28. So when does ovulation happen? Day? What day? Day 5?
After finish
No, when does ovulation happens during your menstruation? What day? You say the normal day is 1 to 28. No, when does this happen? Which part? Day 14, in the middle. Okay? That is the time the follicle rupture, you release the egg. Okay? So that is the time, okay, your body temperature is high. So it increases the woman's body temperature by as much as 0.3 to 0.6 degree Celsius. Last one, not last one. Okay, another one will be stress. Okay, if a patient is stressed, so look at this, a highly stressed or anxious patient, anxiety. Okay, anxiety is noun, adjective, anxious. Okay, so a patient who is stressed may have elevated body temperature due to the secretion. What's the reason? If they ask you, is the reason due to the secretion of your catecholamines. Okay, that increases the metabolic rate. What do you mean by catecholamines? Your epinephrine and norepinephrine. Okay. Okay. We call them catecholamines. Okay. So expect that if the patient is stressed or nervous, okay, the body temperature is increased because of the secretion of your catecholamine. That increases the metabolism. Okay. Next will be your environment, the environment around you. Okay, like now, winter. Okay, so extremes environmental temperatures can affect a person's temperature regulatory system. Okay, or what we call your thermoregulation, right? The one I wrote down earlier here, due to decreased thermoregulation. Right? The same, thermoregulation or thermoregulatory system. Right? This is 3 words. I put them in 1 word, thermoregulation. Right? Or you can say temperature regulatory system. Okay? The same. Okay? 1 word, this is 3 words. Okay? Where is the temperature? In the hypothalamus. Okay? Hypothalamus. Okay? So these are the factors affecting the body's temperature. Okay? We now go to factors affecting the heat production. Okay? Okay? Number 1 will be your BMR. What is BMR? Metabolic rate. Okay? So BMR, basal metabolic rate. Okay? So this is the rate of energy utilization in the body required to maintain the essential activities such as breathing, okay? The pumping action of the heart, okay? Right? You have to do those things in order for you to live, right? Like your breathing, okay? Heart contraction, okay? So remember, BMR decreases with age, okay? BMR decreases with age. As you grow older, your basal metabolic rate decreases. Eh? That's why you have to, you know the difference, eh? Child and an elderly. Who eats more? The child. Eh? The elderly eat less because they don't require much energy. Okay? So in general, the younger the person, so if the younger the person, the higher is your BMR. Correct? There. Okay? The younger the age, the BMR is increased. Okay? If you increase the age, the BMR is decreased. Okay? Next, another factor that affects the heat production in the body will be the muscular activity. Okay? If the muscles are contracting. Okay? Example, okay, shivering. Okay, shivering like that. Okay. When you shiver, your muscles are contracting. Okay, what is the function? To increase the BMR. Okay? So shivering increases your metabolic rate. Okay. Next will be thyroxine output. What is thyroxine? T4, right? Don't know. T4. The hormones secreted by the thyroid gland. What are the hormones secreted by the thyroid gland? You have T3, T4, and calcitonin. Okay, these are the three hormones secreted by the thyroid gland. Okay, what's the function of these hormones? Okay, it controls your metabolic rate. Right? Thyroxine is the other word for T4. Okay, so thyroxine output is also a factor in heat production. So what happens to the body? If you secrete T4 many, so what happens? Your BMR also increases. Okay? Not decrease, increase. Okay? So increased T4 also increases your metabolic rate. Okay? Correct? Because your metabolism will become faster. Right? Okay? Next will be your SNS. You know SNS? No? Sympathetic. Sympathetic nervous system. Okay? Sympathetic nervous system. We use the symbol SNS. Okay? You know the nervous system, right? Nervous system is like a switch, right? It turns on the body, it turns off, right? The sympathetic nervous system is the one that turns on the body, okay? The parasympathetic nervous system is the one that switches off the body, okay? Okay? Sympathetic, parasympathetic nervous system, okay? On and off, okay? So, when you stimulate the SNS, what happens to the body? The body will secrete your epinephrine and norepinephrine, right? This will what? Increase your metabolism, okay? Okay? And lastly, fever. Okay, so if the patient have fever, okay, it increases the cellular metabolic rate, thereby increasing the body's temperature also. Okay? Okay, so those are the factors that affect heat production. Okay, heat production. We now go to factors affecting the heat loss. Okay, heat removed from the body. Okay, we call it heat loss. Okay. Okay, so you have 4 types. Okay, heat loss. Okay, number 1, radiation. Okay, what do you mean by radiation?